Hi, my name is Ashley Green, and I'm going to be presenting you with some information regarding hypertension. Now, this is what I have created as an educational piece for the age group of 65 and up. That population is my target. For the development of this project, I obtained this topic through actual patients that I was seeing in the emergency department. And during the preparation of my project, the patients that I was seeing come in were suffering severe complications from hypertension. And while obtaining health information and history from these patients, it seemed as if they were non-adherent to medications and lifestyle changes that they were recommended to take. But it really wasn't non-compliance on their part. It was more of health illiteracy. They lacked the knowledge. They didn't retain the knowledge that they had previously been taught. So they were stating they just didn't understand it. They didn't know. They didn't retain it. And so the patients were revealing that they were thinking that you could take your blood pressure medication and then just stop it if you were seeing numbers come down. And they weren't following up with their doctors. And also they were reporting that they didn't understand that it had caused their previous stroke or heart attack. They didn't understand the importance of the numbers. And so I felt that was an important topic to go ahead and approach with. And I even asked these patients that would they feel like something tangible they could keep would be beneficial for them, as they could refer back to it at home. And they thought that was a great idea, something broken down to where they could understand it. So older patients have difficulty learning a lot of information at once due to cognitive changes with their age. Excuse me. They also have a reduced speed in processing information that they're given. So I focused on limiting the information I was bringing forward. And I tried to just target the information that they had voiced were concerns. So this is very beneficial to them because, like I said, they can refer back to it. They can hang it on their refrigerator, or they can keep it on their desk. They're just somewhere where they keep important things and they can quickly look back to it, especially if they're monitoring their blood pressure. It's a good reference. There are good references on here. So there's also visual changes with older adults. So I utilized a white background for nice contrast with the dark font. And I also used large numbers. So I didn't go below a size 14. I tried to stay in the 16 to 22 range with my font so that it would be easy for them to see. I try not to crowd it because that could be overwhelming. If there's not enough space in between, it could be crowded and then really confuse them. Let's see. I tried to keep a little bit of color difference in my headings, just to add a little creativity to the project. I also have a red heart down here at the bottom to symbolize heart health, that's what we're talking about. Your heart's important. And there's also a link at the bottom. And this is for the American Heart Association. And these aren't just my words. This is all information that I've gathered to create this teaching project from the American Heart Association. And these are their updated guidelines from 2018. So this is going to be my educational piece. It's hypertension. And I have that in big letters up top. It's high blood pressure. Because sometimes we say hypertension to patients. Do you have hypertension? No. Do you have high blood pressure? Oh yeah, I have high blood pressure. So I thought it was important to put both of that wording there so that they understand that they are one and the same. And it is a silent killer, and so that kind of grabs their attention. Oh, silent killer, because sometimes you don't always know you have hypertension. So first we go with it increases your risk, and I have all the things that you're at risk for if you have uncontrolled hypertension, and why it's important to prevent these by recognizing you have hypertension and to following through with your treatment plan. Second, we have how you can control it. Some things are modifiable in our life, and I have those listed here. Things like exercise, physical activity, maintaining a healthy weight, the DASH diet, reducing sodium, and stop smoking, avoid secondhand smoke, and then taking your medications as prescribed. And then down at the bottom, another little section we have is knowledge is key. And this breaks down different blood pressure ranges for you. What's normal, what's elevated. You have stage 1 and stage 2 category by the American Heart Association guidelines. And then at the bottom, I added red. I didn't want to put too much color, again, for the contrast, but immediately is in red. And that is when you need to immediately seek help with your blood pressure. And that's systolic, greater than 180, and 120 diastolic. And that's to grab their attention. It's not too much, but just enough to grab their attention. Then we have our risk factors here, so that if you don't have hypertension, you can still use this as a piece of education to know what your risk factors are, and the ones that you can change. And see, that goes back here. They can refer back to what they can control. And then we also know your numbers. Sometimes we throw out the word systolic, diastolic when talking to patients. And older adults may not say, I don't understand. They may not say, I don't know what that means. They may just take it in, go home, and they don't know. So this just kind of breaks it down for them. You have your systolic, you have your diastolic. And it says that's your top number and that's your bottom number, so that they're aware, especially when referring to the guidelines. And then there's the diet recommendations, fruits, vegetables, whole grains, low-fat dairy, things that they can do in their diet to help manage their hypertension or prevent it. And then tips of regular checkups with your doctor, and monitor your blood pressure at home, especially if you have hypertension. If you don't, you can still monitor at home. And then if you notice an increase in it, then you can notify your doctor. And then again, we have the reference at the bottom with the heart. And then this is so if they want more education pieces, they can go online to American Heart Association to see that. So this project serves as a source of information for patients, and they can have something tangible that they can continue to refer back to, because they may not retain this the first 10 times. It may take 20 times of seeing it before they understand it. And so that's a good educational piece for them. And this is to just reach our older population to help them to prevent serious injury from hypertension. Thank you.